Finding the root cause of your tinnitus can be extremely helpful in getting the right treatment. So in this video, I want to go over the 20 questions I ask every tinnitus patient and why. And while it's important to get a personalized diagnosis from a doctor like me, this list of questions may help you get the right treatment in place as you do your research. Make sure to stick around until the end of this video because some of the questions that I'll share might lead you towards a cause that you haven't even thought of yet. First up, exactly when did your tinnitus start? Was there anything leading up to this that may have caused it? A stressful period of life, a loud noise exposure, a neck strain, anything like that? Second, where do you hear your tinnitus? Is it in one ear, both ears, or somewhere in your head? What does your tinnitus sound like? The most common responses from my patients are high-pitched ringing, electrical noise, static, or buzzing. But do you hear something else? Let me know in the comment below. Does the volume of your tinnitus ever fluctuate? Does it change throughout the day? Perhaps it's louder in the early morning and when you're trying to fall asleep. Do you notice anything that makes your tinnitus better or worse? I commonly see that stress, poor sleep, and loud noises can make tinnitus worse, while relaxation, sound therapy, and being focused on work can make tinnitus better. On a scale of 1 to 10, with 10 being the loudest, how loud or intense do you perceive your tinnitus on average over the last 2 weeks? Is there any history of neck injuries, jaw issues, or recent dental work? Or does moving your neck or jaw significantly change the sound of the tinnitus? Have you had a hearing test? And if so, what did it show? About 80% of my patients have some degree of high-pitched hearing loss, while 20% have gotten a standard hearing test that showed normal hearing. Just a quick reminder that if you want to discuss your hearing test results with my team of doctors, find the links below to schedule a complimentary consultation or give us a call. Our number's on the screen. Number 9, on a scale of 1 to 10, with 10 being the most bothersome, how would you rate your tinnitus on average over the past 2 weeks? Does it impact your sleep? Does it interfere with your ability to work or concentrate? How exactly is it negatively affecting your life? Number 10, do you have any history of head or ear injuries, perhaps perforating your eardrum or getting in a car accident? Have you been around a lot of loud noises in your lifetime, perhaps attending concerts or working with loud machinery? Tinnitus can be an early symptom of noise-induced hearing loss. Is there any family history of tinnitus, hearing loss, or other ear issues? How about any medical ear issues, like childhood ear infections or ear surgeries? Any dizziness or vertigo? Any history of anxiety, depression, or PTSD? Are you taking any medications? What medications have you been on in the past? Sometimes we find that tinnitus is caused by changes to medications. So if you've noticed the onset of tinnitus around the time that you started a new medication or changed the dosage, it's definitely something we want to look into collaborating with your physician. Some medications, even over-the-counter medications, can have side effects of ear ringing. And fortunately, this does not mean that your hearing is changed forever. And when we can get this in the right place and managed and get the right dosage of this medication figured out, you're likely to notice improvements with your tinnitus. Number 17, any sensitivity to sounds. Do everyday noises like water running, dishes clanking, people's voices sound very loud? About 30% of my patients experience this, and we call it hyperacusis. It's important to build out a treatment plan considering whether you have tinnitus only or tinnitus with hyperacusis. What things have you already tried for your tinnitus and how did those go? This is such a revealing question because it allows me to understand the various tools that you may have already tried, and I need to verify that you've done them properly. Some people say, oh yeah, I've tried sound therapy, and I ask more to explain how they've used it. And they say, oh yeah, I listened to a YouTube video for 30 minutes, didn't really do much for me. So that's not sound therapy. That's using a sound therapy track, but it's not following a protocol of using it consistently for most waking hours for a period of days or weeks. So make sure that we have the right treatments following the right protocol in place. Number 19, any pain in your ears or when hearing loud sounds. Sometimes medical ear issues can be related to tinnitus, and pain when you hear loud sounds is a form of pain hyperacusis. Question 20, what would be your goal regarding treating tinnitus? I want to share an example. The average patient who comes to us, they have a 6 out of 10 in terms of the intensity of their tinnitus, and they're aware of the sound about 80% of their waking hours when they reach out to me. So how I would approach that goal setting is to say, in a 6-month period, if we can improve the intensity of your tinnitus from a 6 out of 10 down to a 3 out of 10, and the awareness of the sound from an 80% during waking hours down to a 20% during waking hours. If we can get that done in 6 months, would that be a success? And many of the patients that I speak with, they say, yes, that's what I'm here for. Now, if you had the wrong expectations, you might think that, no, I'm looking to completely eliminate this sound. I don't want to hear it anymore. While that can happen, it's very rare. Most people are still managing a mild degree of tinnitus even after a successful tinnitus treatment. So with that in mind, remember that tinnitus is a treatable condition. Have hope. I'm here to help. To schedule a complimentary consultation with an audiologist from my team at Treble Health, find the link below or give us a call on the screen. Please take your tinnitus journey one step at a time and use the questions in this video to identify what is the potential root cause of your tinnitus and work with a professional who understands the full degree of what is available to help you.